Imagine a time long ago, before X-rays, MRIs, or even antibiotics. It was a period when medical knowledge was limited, and doctors had to rely heavily on their intuition and basic observational skills. In the early 1800s, being a doctor was very different. The tools and techniques we take for granted today simply didn't exist. Doctors relied on their senses to diagnose illnesses. They had to be keen observers, using their eyes, ears, and hands to gather clues about a patient's condition. They looked at patients' tongues for signs of disease, felt their foreheads for fever, and most importantly, listened to their chests. Each of these methods provided vital information. Listening to a patient's chest was called auscultation. This practice was crucial for diagnosing respiratory and cardiac conditions. However, doctors didn't have stethoscopes back then. The invention of the stethoscope was still years away. Instead, they would press their ears directly against a patient's chest to listen to the heart and lungs. This method, known as direct auscultation, was the best they had. This method, called direct auscultation, had many problems. It was far from perfect and often led to challenges. For one, it was awkward and uncomfortable for both the doctor and the patient. The close physical contact could be invasive and unsettling. It was also difficult to hear subtle sounds, especially from female patients who wore layers of clothing. The fabric muffled the sounds, making accurate diagnosis harder. Sometimes doctors even misdiagnosed illnesses because they couldn't hear clearly. The limitations of their methods often led to errors in judgment. Medical practice desperately needed a better way. The challenges faced by doctors in the old days highlighted the need for innovation and improvement in medical tools and techniques. In Paris, a young doctor named René Laennec was troubled by the limitations of direct auscultation. He found it difficult to hear the internal sounds of the body clearly, which often led to inaccurate diagnoses and treatments. Laennec was a bright and caring physician who wanted the best for his patients. He was dedicated to improving medical practices and was always on the lookout for innovative solutions to common problems. He knew that hearing their heartbeats and breathing clearly was crucial for making accurate diagnoses. Without precise information, he felt he was failing his patients, and this weighed heavily on his conscience. One day, Laennec was walking through the courtyard of the Louvre when he noticed some children playing a game. The sight of their innocent playfulness brought a smile to his face. The children were holding long wooden sticks to their ears and tapping on the other end. They were laughing and seemed fascinated by the sounds they could hear. The sound traveled clearly through the wood, amplifying even the faintest noises. This simple yet effective method of sound transmission intrigued Laennec. This simple observation sparked an idea in Laennec's mind. He began to wonder if he could apply the same principle to medical practice. Could he use a similar principle to listen to the sounds inside the human body? The idea seemed revolutionary, yet so simple. Laennec was determined to find out. He began experimenting with different materials and designs, driven by the hope that he could create a tool that would transform medical diagnostics forever. Immediately, Laennec rushed back to his office at the Necker-Enfants Malades Hospital, his mind racing with possibilities. He had been pondering over a problem that had been troubling him for days, and suddenly, an idea struck him like a bolt of lightning. He grabbed a sheet of paper and rolled it into a tight tube, his hands moving with a sense of urgency and excitement. This simple act was driven by a flash of inspiration that he hoped would lead to a significant breakthrough. He placed one end of the tube on a patient's chest and the other end to his ear, his heart pounding with anticipation. The room was silent, save for the faint rustling of paper and the patient's breathing. To his astonishment, he could hear the patient's heartbeat more clearly than ever before. The sound was crisp and distinct, resonating through the paper tube as if it were a conduit for life itself. The sounds were amplified and distinct, as if he were listening through a loudspeaker. Each beat was a revelation, each murmur a clue to the mysteries of the human body. Laennec realized that he had stumbled upon something truly groundbreaking. His mind raced with the implications of his discovery, and he quickly began jotting down notes, his pen flying across the paper. Excited by his discovery, Laennec experimented with different materials and designs. He was determined to refine his invention, to make it more effective and reliable. He tried using various types of wood, metal, and even glass, constantly refining his invention. Each prototype brought him closer to the perfect design, each test a step towards revolutionizing medical diagnostics. After much trial and error, Laennec created a wooden cylinder, approximately 12 inches long and 1.5 inches in diameter. He carefully carved a hole through the center of the cylinder, creating a hollow tube. This simple yet ingenious device would forever change the way doctors listen to the body. Laennec named his invention the stethoscope, from the Greek words stethos, chest, and scopein, to view or observe. He published his findings in 1819, describing the stethoscope and the various sounds he heard from the heart and lungs. Section 5. A revolution in medicine. The invention of the stethoscope revolutionized medical practice. Doctors could now listen to the internal sounds of the body with greater clarity and accuracy. They could detect heart murmurs, irregular heartbeats, and lung diseases that were previously difficult or impossible to diagnose. The stethoscope allowed doctors to diagnose and treat illnesses more effectively. It also helped to advance medical knowledge by providing a new tool for research and observation. The stethoscope quickly became an indispensable tool for physicians worldwide. Section 6. From wood to rubber. Over time, the stethoscope underwent significant improvements. In the 1850s, a rubber tube replaced the single wooden cylinder. This innovation allowed for binaural listening, meaning doctors could now use both ears, further enhancing sound quality. The chest piece also evolved, with the development of different shapes and sizes for listening to specific areas of the body. From its humble beginnings as a simple wooden tube, the stethoscope transformed into a sophisticated medical instrument. Section 7. The stethoscope's legacy. Today, the stethoscope remains an essential tool for doctors, nurses, and other healthcare professionals. It is a symbol of medicine, representing the doctor's ability to listen and understand the human body. From its accidental invention by René Laennec to its modern-day advancements, the stethoscope has come a long way. It stands as a testament to human ingenuity and the constant pursuit of improving healthcare. Section 8. A symbol of healing. More than just a medical instrument, the stethoscope represents the intimate connection between a doctor and a patient. The act of listening carefully and attentively forms a bond of trust and empathy. When a doctor places a stethoscope on your chest, it's a sign that they are fully present, ready to listen to your body's story. The stethoscope has transcended its practical use to become a powerful symbol of healing, care, and compassion in the medical profession. Section 9. The future of listening. While technology continues to advance at a rapid pace, the stethoscope remains an integral part of medical practice. Though now equipped with electronic amplification and digital capabilities, the fundamental purpose of the stethoscope remains unchanged: to listen to the sounds of the human body. As we look to the future of medicine, one thing is certain: the stethoscope, in its various forms, will continue to play a vital role in helping us understand, diagnose, and treat illnesses for generations to come.